So I just gotten back from Zimbabwe. I was HIV positive. I knew nothing, pretty much nothing about HIV, and certainly, there was very little going on around HIV and women at that time. And we really felt like we need to do something around HIV positive women. People are paying a lot of attention to women's prevention issues, but not a lot is known. Not a lot of attention is being paid to women who are living with this virus. So some current priorities for women in HIV, there's so many. So in no particular order, I think, given that we've just had a look at the epidemiology, I think one thing that we need to say is that we need more and better epidemiological data, which talks to us about the trends, the risk factors, and I think it's very important also to note the geographical differences, even within Canada, in HIV/AIDS, amongst women, in order to develop initiatives that are specific to women. And we need to target not only women's sexual risks, but also women's drug-using risks. And there's often not a lot known about women's injection drug use patterns and how those put them at risk for HIV. We need to continue to focus on reproductive issues. We've had a lot of success here in Ontario in 2007 with our opt-in testing program. 94% of pregnant women in Ontario were tested for HIV. And I think the PHAC numbers say that no babies were born with HIV in Ontario in 2007. But I know from talking with the Hospital for Sick Kids that they dispute that and think that there were a couple. But, I mean, that's quite a reduction in mother-to-child HIV transmission. And another important issue is certainly women-controlled reproductive and HIV prevention technologies, especially a technology that covers both HIV prevention and birth control is important. So things like the female condom, but also microbicides, which have been a focus of work around women's prevention, and also pre-exposure prophylaxis and post-exposure prophylaxis methodologies for women, I think, are an important issue. Next slide. Continued research into women's specific biological vulnerability, STIs and how they affect women, and certainly treatment of STIs among women. There's a lot of work to be done on what is called the structural or social determinants of health that contribute to women's social vulnerability. So things like our safety in our relationships, the issue of stigma, the way that we can be subordinated to men in terms of education, employment, social and legal status. Meskaram talked about the criminalization of HIV non-disclosure, which is a very hot issue and certainly has an impact on women. And I think, I borrow this from a session that Katunde participated in at the recent OHTN research conference, the idea that one size does not fit all when it comes to women. We need to have not just gender-specific initiatives, but we need to target specific populations of women, such as sex workers, women from HIV endemic countries, Aboriginal women, prisoners, and the list goes on. Next slide, please. So a couple of examples of good practices in Canadian women's leadership in HIV/AIDS. I borrowed these from Christy Johnson at the Canadian AIDS Treatment Information Exchange. She's starting a project called the Programming Connection, which looks at best practices around HIV/AIDS in Canada. And she gave me some of the ones that she's working on that are women specific. So if we go to the next slide, we have a project by Chimamuk, which is an Aboriginal organization in Vancouver. It's delivered provincially, and the initiative is called Around the Kitchen Table. And what this project does is it trains Aboriginal women to go into their communities, meet informally with other women, other Aboriginal women. They're trained to talk about sexual health, HIV, STIs, as they engage in traditional crafts, so beadwork, making, weaving, that sort of thing. So women are really engaged in that project because it brings them back to their culture and gives them an opportunity to talk about these important health issues at the same time. So ORCID is a project of Asia, a organization in Vancouver which targets Asian people. And this is a very successful project. I believe they've been working on it for 4 years. And what they do is they go to female sex workers who work indoors in sex venues, and they talk about HIV, STI, risks, prevention, etc. in the actual venue. And they've been able to go to, they've been able to reach out to women in 55 different indoor sex venues. And this is delivered in a culturally and linguistically appropriate way. The Positive Women's Network's wellness retreats, I talked a little bit about that network in Vancouver. It's based in Vancouver. It's province-wide. And this is an extension of their larger support program. And what it is it's a health promotion retreat that takes place outside of the city and brings positive women together from all across BC. So some very isolated women get an opportunity to come to this wellness retreat, kind of recharge their batteries, meet other women with HIV, and form networks. And finally is a project in Quebec delivered through the University of Quebec in Montreal. So a university-delivered project, but rolled out in the community that has been evaluated and been shown to be effective. And what this project does is it enables women to consider the issue of disclosure together and decide who they want to disclose their status to, how they're going to do it, support one another around strategies for disclosure. But most importantly, it doesn't demand that women disclose. It gives them an opportunity to think about this issue in a very kind of thoughtful and dedicated way. So finally, some ideas about how to enable, amplify, and mobilize women's leadership in HIV. So, I mean, I think we have to begin from a gender-based and a rights-based framework. That needs to underline whatever type of work we do. I think specifically, it's very important to develop HIV leadership programs specifically for women. I think some of the skills that those leadership programs need to take into consideration in order to really amplify women's leadership are skills in policy analysis, in advocacy. Those are very important to get across the messages that we need to get across about ourselves. Also, the dissemination of effective program models, good financial management, communications, so that our organizations are strong, so that our messages are pertinent and get to the people that we want to be speaking to. Clearly, we have to involve women with HIV in this work, but I think we also need to pay attention to the role of allies. I think, you know, in the olden days, in the early 90s, there was a kind of separatist tendency, not just in work done by women with HIV, but in the whole HIV field that really looked at people's serostatus and said, you know, HIV positive on one side, HIV negative on the other side, and never the twain shall meet. But I think it's really important that we look to one another for support and develop allies in this work and look at our specific expertise and how that can enhance the work that we're doing. Finally, we have to continue to make available to women voluntary HIV testing and also access to treatment. This is very important. Research in BC that's been done recently has shown that up to 1/3 of the women in that province die of HIV/AIDS before they've ever accessed treatment. That's completely unacceptable. We have to target women's sexual and reproductive health, and also our economic security and our access to resources.